What are the common anti-gout medication side and adverse effect? So basically here we are going to see the anti-gout means allopurinol, colchicine, or other anti-gout medication like probenecid, their side effect, right? So the common adverse or side effect of anti-gout, they can cause headache or GI upset like nausea, vomiting, and diarrhea. Sometimes blood decreases. It is very important to evaluate like bone marrow suppression. As you know, the bone marrow can produce red blood cell, white blood cell, and platelet. So when blood decreases occur or bone marrow depression or suppressed occur, patient develop anemia, thrombocytopenia, or leukocytopenia. Also flushing skin and rash. Uric acid kidney stone. So if patient take anti-gout medication for a long time, they chance to develop uric acid stone formation, we call renal stone. Or also the metallic taste is a common side effect. What are the intervention? We monitor the serum uric acid level, right? Because in gout, the uric acid deposit monitor the input and output. So we have to make sure my patient take enough fluid. So if the small stone formation, it will be easily clear out through the urine if patient take enough fluid. What are the other intervention? So we maintain the fluid intake at least 2 liter to 3 liter or 2000 to 3000 milliliter. So NCLEX board if give 2 to 3 liter per day, it is right, or 2000 to 3000 milliliter, because we know 1 liter equal to 1000 milliliter. Also, we need to know complete blood count. Why complete blood count? Because the side effect, common side effect is blood decreases. Re-educate the instruction to the client to avoid alcohol and caffeine because this product can increase uric acid level. The client is encouraged to completely with therapy to prevent elevated uric acid level, which can trigger a gout attack. Reinforce the instruction to the client to avoid the food which is high in purine, such as what kind? Too much purine, like wine, alcohol, organ meat, seafood, salmon, right? Sardine. So if my patient has a gout, tell them not to drink beer. Tell them not to drink too much wine, not too much alcohol, or seafood, not. Because they contain purine, and purine lead to develop, increase the uric acid level. Reinforce instruction to the client to take the medication with food to decrease the gastric irritation. So again, all anti-gout means colchicine, allopurinol, probenecid, it is good to take with food. Why? To prevent gastric irritation or upset. Next. So reinforce the instruction to the client to report side or adverse effect to healthcare provider. Reinforce instruction to the client not to take aspirin with this medication. Why? Because this could trigger a gouty attack. So aspirin, very friendly drugs for our heart. It prevents heart failure. But aspirin with allopurinol, aspirin with colchicine, aspirin with probenecid, not good. So now particular information we're going to share about allopurinol. Allopurinol can increase the effect of warfarin and also oral hypoglycemic agents. So increase, my friend. So bleeding time go up. Enforce the instruction to the client not to take large doses of vitamin C while taking allopurinol because kidney stone may occur. So allopurinol and vitamin C, but iron and vitamin C defined, right? So iron is good to take with vitamin C, increase the absorption. But iron with milk product never ever together. But allopurinol and vitamin C, it is good not to take together because patient tends to develop kidney stone formation. Next, allopurinol hypersensitivity syndrome. What it is? If patient have a allopurinol hypersensitivity, how we characterized it? Some skin rash, body temperature raise, fever, or eosinophilia, increase in blood. Eosinophil, one of the component of white blood cell. Allergic reaction, increased eosinophil, we call eosinophilia. Or dysfunction of the liver and kidney, if hypersensitivity. But it does not mandatory every patient have to have it. If you are so sensitive to allopurinol, no problem. Go for the colchicine, go for the probenecid, and keep that document in your patient history. They have a hypersensitivity reaction to allopurinol. Colchicine used with some caution precursor in older client or debilitated client, the client with the cardiac problem, client with a renal problem, problem with the gastrointestinal disease. So if our patient has a kidney problem, right? If our patient has a heart problem, we do not give colchicine. Or if our patient have a GI problem, we do not give them colchicine, right? Stomach. So again, here, the gastrointestinal syndrome occur usually upset, we call nausea, vomiting, diarrhea, and abdominal pain. Right? If we see any problem like this, we always notify to the healthcare provider and we stop this medication. So now probenecid. So it is mild gastrointestinal effect. So it is better than the colchicine, right? Colchicine cause a little bit severe gastric upset. They can cause mild and can be reduced by taking the medication with food. And already we know the anti-gout food always good to take with food. Aspirin or other salicylate interfere with uric action of medication. what need to know for NFlex board? Let me talk about. So this one here, the concurrent use of anti-gout medication and aspirin can cause elevated the uric acid level. So if NFlex board asks, we have to answer this. So aspirin and probenecid increase the uric acid level. So the client should be instructed to take acetaminophen. So I have a pain. You give me the pain medication, but I have a problem with gouty drugs and aspirin. So you have to check for something alternative. And friendly drugs is there, and it is acetaminophen. Everybody know it is called Tylenol. We can buy over the counter, right? Tylenol is very friendly medication, widely used, but there are some side effects, right? We have to know about this. So next here, now we are going to talk about the anti-arthritic medication, right? So anti-arthritis, so it is a common term. So here, like first one, rheumatoid arthritis. Rheumatoid arthritis occur as an inflammatory process. We are going to talk all kind of arthritis now. Osteoarthritis, rheumatoid arthritis, osteoporosis, all compare and contrast. So rheumatoid arthritis is the inflammatory process, right? Inflammation occurs inside the synovial, cartilage, or bones. If this inflammation is not controlled, it will lead to joint destruction, joint deformities, or thus affect the client mobility, restriction the mobility, and comfortness. So osteoarthritis, shortly called RA, right? The chronic inflammation. And also chronic inflammation or disorder affecting many joints, including those in the hands and feet. In rheumatoid arthritis, the body's immune system attacks its own tissue, including joints. In severe cases, it attacks the internal organ. So the focus of the treatment in the early diagnosis and aggressive treatments in order to progress of joint function, to prevent the progress of the disease. This PowerPoint, we are going to talk about the musculoskeletal medication. It is not pathology or physiology. I'm going to focus only the treatment option for NFlex board. The medication therapy include NSAID or glucocorticoids and disease modifying anti-rheumatic medication. So how we differentiate osteoarthritis, rheumatoid arthritis and osteoarthritis together, right? So if anybody asks, or if particularly we have to know, right? The very basic things. So as I told you, the rheumatoid arthritis particularly attack or start in small joints in hands or feet, and it can then spread to the wrist, elbow, shoulder, neck, ankle, or knee and hip joint. So rheumatoid arthritis started from small joint in hand and feet, but then they spread to the big joint like shoulder, neck, ankle, or knee joint. And rheumatoid arthritis pain is in symmetric joint. Means if you have left hand joint, you have to have the right side hand joint involved as well. So same on both sides of the body. And morning pain or stiffness for more than 30 minutes. So when you get up from the sleep, the pain start at the morning. Then when you started your life, activity increase, pain will subside. What else? The osteoarthritis. Basically, osteoarthritis can affect different joint in the body. And based on thumb or any one knee joint or one hip joint or big toe, right? I said any joint, small or big. And that tends to be one side rather than symmetrical, not both sides, like rheumatoid arthritis. And typically, osteoarthritis occurs later in life, but can start earlier in joint already affected by rheumatoid arthritis. And usually the stiffness less than 30 minutes in the morning, and joint feel bony but not the soft swelling. It is the easy way we could differentiate or compare and contrast between rheumatoid arthritis and osteoarthritis. Let me go and let me focus on the treatment option. We use non-steroidal anti-inflammatory. We can use glucocorticoids or DMARD. So what does it mean? DMRD, it is disease modifying anti-rheumatoid drugs. D for disease, M for modify, E for anti-rheumatoid drugs. As I told you, or it is there, it is a chronic inflammation. So you see the NSAID has the effect to reduce the inflammation. Steroid, glucocorticoid, has the properties to reduce the inflammation. Also, the MD means disease modifying agents also reduce the chronic inflammation. Okay. Also, we use the gold salt. The use of gold salt has decreased, but their purpose is to reduce the progression of joint damage. Joint damage caused by arthritic procedure. But gold has some toxicity, right? Which include itching or pruritus, which can cause skin rash or metallic taste, or stomatitis, diarrhea, or can occur if toxicity occur. We use antidote. And let's go ask the question from here. What are the antidote for gold salt? It is D-marcaprol. So the antidote for gold toxicity. What else? And this is the beautiful picture. We can see this one, articular cartilage, knee joint, right? And this is the ending plate, bones, end plates, and synovial joint, or synovial cavity and membrane. Rheumatoid arthritis affect this joint. It is a progressive, chronic, inflammatory, degenerative disease. So here you can see after inflammation or degeneration, how it is look like. Inflamed, ruptured, broken, disturbed, erosion, and two bones is more closer and causes the pain. Right? Now, next here, these two. So peanuts formation and erosion. You see the ending plate is eroded and this is totally fused. More pain. Patient need immediate surgical management. Onset of peanuts formation or cartilage erosion. Then two bones is almost together, fusion together, articular cartilage here. So what are the medication we use? Other medication, anti-arthritic medication. Basically, we use anakinra or adalimumab, alemtuzumab, or azathioprine. So you see, most of the drugs is immunocomponent, like adalimumab, alemtuzumab, or azathioprine, cyclosporine, etanercept, or hydroxychloroquine, infliximab, methotrexate, rituximab. So most common drugs. So I said adalimumab, azathioprine, cyclosporine, etanercept, hydroxychloroquine, infliximab, methotrexate, or rituximab, most commonly used. And we also use sulfasalazine. What next? So now we are going to focus in the disease modifying agents. They have effective to anti-rheumatoid medication that are used to slow the degenerative effect of the disorder. And they usually prescribed secondary to NSAID, but are often the first choice in the treatment of severe arthritis. So if my patient has a mild or moderate, we give them NSAID, we give them steroid, but if they do not work, then we go for disease modifying agents. Or if the patient have a severe problem, we give them disease modifying anti-arthritis drugs. Some medication are contraindicated during the pregnancy. So what else? What are the common side effects or adverse effects? So it includes injection site or inflammation or pain. Ecchymosis means blood clot, or edema, swelling, bone marrow suppressed, or infection, fatigue, headache, nausea, vomiting, flu-like symptom, and allergic response. Let me recap something. So these agents can cause bone marrow suppression, right? And our bone marrow can produce different type of cell, right? So one of the cell is WBC. So when the bone marrow suppression, because of this, WBC production go down. When WBC production go down, neutrophil go down, macrophage go down, and this is the two major player to defend the infection. They play important role to kill the bacteria. When WBC go down, neutrophil go down, monocyte go down, bacteria attack our body and infection occurs. So infection is more common. When infection is occur, temperature is raised. So patient develop flu-like symptom. So it is actually related with each other. What next? So here intervention. The client is instructed monitoring for sign of infection and report the sign to healthcare provider, if any. Monitor the injection site for sign of irritation, site, inflammation, and swelling. So you see that the sentence here, monitor for the injection site. Why it is talking about this? Let me go back. This is the defective joint, and we have to put injection form, right? When we give the injection in this site, patient inflammation or relieve the problem. And when relieve the problem, this occur, right? So we are talking about the inflammation or injection site. So here, monitor the injection site, irritation, pain, inflammation, or swelling. Reinforce instruction to the client or inform the importance laboratory test for neutrophil count, white blood cell count, platelet count, and for before initiation of the treatment and during the treatment. Why, my friend? The disease-modifying agents can cause bone marrow suppressed, and bone marrow suppressed means patient can develop neutropenia, leukopenia, thrombocytopenia. So we need to count white blood cell, platelet, and neutrophil. Particularly, medication anakinra injection site rejection are common. Is sign, arthritis, erythema, rash, and pain. What else? What are the other substances we use? So what are the other medication we use? We use adalimumab or alemtuzumab. We use azathioprine or cyclosporine or etanercept. So the commonly we can tell it is the immunocomponent agents. They have a common nature. But when we use this medication as an anti-arrhythmic, anti-arthritic, which is called disease-modifying agents. What else? Particular information about the particular drugs. Like adalimumab, injection site reaction are common or has been associated with neurological injection. So neurological injuries, what does it mean? Neurological injuries means the numbness, tingling sensation, dizziness, disturbed vision, or difficulty of vision, weakness in the legs. Azathioprine, it is immunosuppressive and anti-inflammatory action. Toxic effect include causes hepatitis or blood dyscrasis. In case of azathioprine, what else? Cyclosporine, most popular drugs we use. This is an immunosuppressive action. They help your body, but on the other hand, they cause immune system suppressed. Infection is most common. Anemia developed. Cyclosporine save your life, but a lot of side effect. Can cause nephrotoxicity, kidney gone. Etanercept, injection side reaction are common, also poses a risk for heart failure, has been associated with central nervous system demyelination disorder, also hematological disorder as well. Another drug is called hydroxychloroquine sulfate. It is associated with retinal damage, eye problem. The client is informed to contact the healthcare provider if visual disturbance occur. Methotrexate can cause hepatic fibrosis, can cause bone marrow suppression, can cause the ulceration, gastric ulceration, or pneumonitis, lung infection. Methotrexate, commonly used for certain kind of carcinoma, or infliximab can cause infusion reaction like fever, chill, pruritus, urticaria, chest pain, and also hepatotoxic. You may ask me if the drugs can cause liver problem, kidney problem, why we choose it? Because no other option, life-saving. So when no medication is work, or patient has a autoimmune disease, patient want to survive, you give them these groups of drugs, although they have a major side effect. And we have to check the organ function test, kidney function, liver function. Last drugs here, it is called sulfasalazine. Sulfasalazine can cause gastrointestinal or dermatological reaction, bone marrow suppression, or hepatitis. So non-steroidal anti-inflammatory drugs may be prescribed for anti-inflammatory effect or analgesic effect. So most common, most popular drugs, NSAID, they have two effects. One is anti-inflammatory, so they reduce the inflammation, and also analgesic, so they reduce the pain, right? They reduce the pain as well. And also glucocorticoid or steroid can be prescribed for anti-inflammatory properties or effect. So they reduce the inflammation, right? So NSAID has two properties, anti-inflammatory and analgesia. Glucocorticoid do not have analgesic effect, but they are super good to reduce and control the inflammation within a time. Next, the medication we use to prevent and treat the osteoporosis. So what are the medication, common medication we use for osteoporosis? So osteoporosis is characterized by low bone mass and increase the bone fragility. So, my friend, the picture is here, you can see, and this is the two bones, right? So bones with osteoporosis. So bone loss is structure. Basically, osteoporosis, usually the disease of advanced age. It is more common in the female than man, as osteoarthritis. So osteoporosis and osteoarthritis is not same, but both occur in advanced level, or female is frequently attacked than man. But osteoporosis is most common who have a low BMI or who is inactivity is more. Inactivity or premature or surgical menopause. So if the menopause start early, you have a chance to develop osteoporosis. Example, if a patient has imagine a patient has diagnosed PCOS, polycystic ovarian disease, and patient need to remove the ovary, right? So menopause will start faster, early. So they may be chance to develop osteoporosis. Also, if anybody take low vitamin D or calcium, they have a chance to develop. But osteoarthritis, it's really metabolic defect disease. So if patient has a osteoporosis, we give them calcium and vitamin D supplement. Calcium and vitamin D supplement can reduce the risks of osteoporosis. Calcium maximize the bone growth early in the life and maintain the bone integrity later in life. The vitamin D ensure the calcium absorption. So vitamin D helps to absorption of calcium. So you need both. The treatment aim at reduce the occurrence of fracture by maintaining or increasing bone strength. Medication that decrease the bone resorption and medication that promote bone formation are used. Anti-resorptive medication include raloxifene or calcitonin or biphosphonate is a drug of choice, right? The three drugs, one is calcitonin, one is bisphosphonate, and raloxifene. Next here, what the other medication list? Let me read it. Calcium, vitamin D, or alendronate. We use the alendronate. So alendronate is used for osteoporosis. Calcitonin, salmon, or raloxifene, risadronate, common drugs. Let me talk about calcitonin. Calcitonin is secreted by thyroid gland and inhibit osteoclastic activity. So there are two types of bones in our body. One is called osteoclast, other is called osteoblast. The clasting means bones destructive, but blastics means bones formation. So when the osteoclastic activity is more than osteoblastic activity, bone erosion occur or bone resorption occur. So if our patient have a osteoporosis, we give them calcitonin, and calcitonin inhibit bad work by osteoclastic activity. They reduce it. Reinforce the instruction to the client on how to administer the intranasal or subcutaneous form depending on route of the prescribed medication. Intranasal route, calcitonin intranasal. Examine the irritation if patient have it, or if patient has an irritation in one nostril, give them alternate nostril for the next dose. When calcitonin is taken, it is important to monitor for hypocalcemia. Now, another drugs we use, it is called biphosphonate, or somebody called bisphosphonate. So they inhibit the osteoclast mediated bone resorption, thereby increase the total bone mass. Biphosphonate or bisphosphonate include alendronate or ibendronate or ricindronate. The contraindication for the client with osteophysial disorder that can impeded swallowing, or for the client who cannot sit or stand for at least 30 minutes. So my friend, what you educate your patient, you must educate after take these groups of drugs, at least don't go to bed for 30 minutes. It is good 30 minutes you walk, you sit, or stand by. Adverse effects include esophagitis, muscle pain, or ocular problem. The client is instructed to contact with healthcare provider if adverse effect occur. Because of the risks of esophagitis, bisphosphate must be administered in the morning before eat or drinking with a full glass of water. This is the question NCLEX board asks. It is important for our NCLEX board. The client must then remain sitting or standing for at least 30 minutes, 60 minutes for ibendronate, 30 minutes for alendronate and ricindronate. What else? Another drug is called raloxifene. Raloxifene has an anti-resorptive medication. They are non-bisphosphonate. contraindicated in clients who have a history of venous thrombus events, must be discontinued 72 hours before prolonged immobilization period, or reinforce the instruction to the client to avoid extended period of restricted activities, right? And last medication here, paratide. They stimulate the new bone formation, thus increasing the bone mass, right? In osteoporosis, bone loss. So you need something to increase bone formation, bone mass formation. So here they said it is a portion of human parathyroid hormone or work by increasing the action of osteoblast, and also reserved for use in the client at the high risk of fracture, and has been associated with development of bone cancer. So it is associated the development of bone cancer. So we have to be aware about this.